demonstrate how to do a blood draw on Dolly. I'm going to draw about 2 mils for a CBC and a blood smear. I'm going to use her cephalic vein. I have a 3 mil syringe with a 20 gauge needle, and a lavender top tube with EDTA, and also my alcohol. So first I'm going to have Kurt hold off her arm, so he's occluding the vein so I can locate it. I'm going to put some alcohol on there to sterilize it. And I'm going to insert the needle with the bevel facing upwards. Okay, and if you could just hold off right there. Alright, and then I'm going to insert it into my tube. Which has been labeled with Dolly's name on it. Okay, so I'm going to do a buccal mucosal bleeding time test on Miss Lila here. She is under anesthesia. I've used this gauze to tie her lip up, so I have access to her gums right here. And then I have a lancet and a piece of filter paper and a timer. So I'm going to remove this safety guard off of the lancet. I'm going to aim it at her gums right above her premolars, and at the same time I hit the button, I'm going to start my timer. So like this. Okay. And then I'm just gonna wait about 5 seconds, and every 5 seconds kind of use the filter paper to wipe away the blood, and continue to do this every 5 seconds until the bleeding stops. So I don't want any blood to come up when I wipe. So right there. And then that was about 1 minute and 20 seconds. I'm just going to record that time. Okay, now I'm going to demonstrate how to make a blood smear. I have 2 slides here that I'm going to use, and I'm going to pull this blood from a lavender top tube, and I'm going to use a pipette. So first, I'm going to draw some blood up into the pipette. And then with the frosted side up, I'm going to put a small drop of blood as close to the frosted end as I can. And then using the other slide, I'm going to pull it back at a 30-degree angle, and then let the blood spread across the edge and then push it back forward. And make sure that it makes a feathered edge. Okay, so now that I've let my slide sit for a little bit and dry, I'm going to go ahead and stain it. I have a clothespin right here, just so it gives me something to hold on to, and then I'm going to put it in each stain for 10 seconds in each color, light to dark. So I'll just put that in there and wait 10 seconds. Okay, and then I'm going to move it over to the middle one. And then go ahead and move it over to the last one. Okay. Now I'm going to take it out and I'm just going to rinse it. The back side, not the side that has the blood on top, so not with the frosted side. In the sink. Got a paper towel here, and then I'm just going to shake it dry. Okay, so now that my slide is stained and dry, I'm going to put it on the microscope so I can examine it. I'm going to start on a low power and just find the feathered edge in here. Dim the light a little bit. Okay. All right, and once I've found the spot right behind my feathered edge where I'm going to do my cell count, then we're going to switch over to the oil immersion high power. So I'm just going to turn the lenses so I get a good space in here. I have my immersion oil. I'm just going to put a drop right onto the slide. And then move on over the oil with the high power lens. And then just refocus here with my fine focus. And then what I am looking for, I'm going to be counting the white blood cells that I see. I'm going to count them until I reach 100. I'm also taking note of the number of platelets that I see in each field or a handful of fields. And I'm also taking note of the morphology of the red blood cells and also some of the white blood cells. Okay, right now I'm going to demonstrate how to run a blood chemistry test. The test I'm going to run today, we just call it the Chem-Tem. It runs ALB, ALKP, ALT, BUN, creatinine, glucose, and total protein. Now I'm going to run this test on serum. My patient sample is serum. I've spun this down from a serum separator tube. So first thing I'm going to do is put the serum in this holder. This is going to go in the machine. I just need to fill it up to that line. Okay, next I'm going to select my patient that I'm running blood work on. Select the catalyst. And then it pops up on the catalyst. This is the machine I'm going to use. And I'm going to select serum. I'm going to put my sample right in here. And then this is the chemistry. And this just clips on like that. And then I'm going to hit run. So now it's running, and we'll get back to it as soon as it's finished. So Rooney's blood chemistry is finished running. I've got the results right here. And it looks like his ALT is slightly elevated. So this is synced up with our computer system, so it's already in his file. I just need to make sure the doctor sees it so they can either make a diagnosis or decide to run more tests. So now I'm going to demonstrate how to do an ELISA test. The test that I'm going to be running today is a heartworm 40X. It tests for heartworm disease and some tick-borne diseases in dogs. Over here I have my supplies. So I have a timer, I have my blood sample, my snap test, I have the conjugate, and then this is just a sample tube for mixing. So we start off by putting 3 drops of blood in the sample tube. Just make sure I get and then 4 drops of the conjugate. And I'm just going to put the cap on this and invert it a couple of times so that it mixes together. And then I'm going to pour it into the reservoir of the test. And then I'm going to wait and watch for the blood as it's running through the test. I'm going to wait for it to insert this tiny little window right here. Alright, so it has started to insert the little window, so I'm going to go ahead and snap it. And then I'm going to set the timer for 8 minutes, because that's how long this test takes to run. So we will check back with that in 8 minutes. So the 8 minutes has passed, and I've got my test results right here. Here is the test. you can see that there is a little blue dot in the upper left-hand corner of this window. That is just the control. So that, because there are no other blue dots, that means that the test is negative. So if there were any other blue dots in the window, it would indicate a positive for either a heartworm or a tick-borne disease, depending on where the dot would lie in the window. But this test is negative. Alright, so now I'm going to demonstrate how to set up and read a PCV on a blood sample, and also how to read the total solids on a refractometer. So first, starting with the PCV, for my materials right here, I have a blood sample in a purple top tube, or a lavender top rather. I have my microhematocrit tubes, citrusseal, and then the rotor for the centrifuge. So I'm going to take I'm going to do 4 of these tubes so that they balance out the rotor and so that the centrifuge is balanced when it's running. And I'm going to carefully take the top off of this blood sample. And I'm just going to fill these tubes up to the blue line and then put it into the citrusseal, which will form sort of a bottom so that the blood stays in there. Okay, there's one, and I'm going to go ahead and set that in the placement holder. So I'm just sticking it straight into the citrusseal, and it just makes like a little cap at the bottom. And I'm putting these in with the cap side out and the side with the blue stripe towards the center. And I just sort of touch the blood to the open side of the tube, and then it just sort of sucks itself up in there like a vacuum. Being careful not to go past the blue line. And the way that I've put these in here is so that it's 1, 2, 3, 4. This way the centrifuge is going to be balanced while it's spinning. And I'm just going to come over here to the centrifuge. First I'm going to put the top on. Put that in there. And make sure that it is set to microhematocrit. And then press start. Okay, so the centrifuge is finished running. So I'm just going to unlock it, pop the top off. And now you can see that these have all been spun down. So take this one. It's been spun down. So this is plasma on top. And the way I'm going to read this is on this chart. I'm going to line it up so that the bottom of the sample is at the bottom and the top of the plasma is at the top. And I'm just going to find a place where those line up evenly with the top of the readings there. Sorry, it's hard to read. So right there. And then wherever the line is where the plasma meets the rest of the blood sample, that's where I'm going to follow that line to just one of these sides. So this patient's PCV, it looks like it's about at 52. I could look at the other three to make sure that lines up and they're the same. And then I'm going to record that for your patient's records. And now I'm going to demonstrate. Now I'm going to demonstrate how to read the total solids on a refractometer. So you take your PCV tube that you just spun down. Here's the refractometer. Going to take one of these microhematocrit tubes that have been spun down and just snap it off. And then dump out the contents of the plasma onto the refractometer. And then I'm going to close it and just aim it towards a light source. So I've got a nice light right above my head right here. And then I'll read the total solids on this refractometer. It's shown right in the middle. So for this patient, it is it's right around 7. So I'm just going to record that real quick. And then make sure I clean the refractometer with a chem wipe. And then just make sure that I put my results in the patient's chart.